Pretty eyes, pretty thighs, shawty, she a dime. Demon girl, evil eyes, she be telling lies. Slim waist.
So today it is my pleasure to talk to Dr. Schmidt, a professor at Florida and the inventor of the Avanca Nerve Graft. So I mean, with such a career going on for you, can we start with you taking us back and telling us about your background?
Of course. Thank you. And also thank you for the opportunity to be here. So my background is I'm formally a trained chemical engineer, although I do more biomedical engineering research now. I started doing my undergraduate. You want to start at undergrad? So started my undergraduate at the University of Texas at Austin, where I did my bachelor's degree in chemical engineering and became interested in biological and biomedical applications, and then did my PhD at the University of Illinois in Urbana-Champaign, and then postdoc at MIT, and then went to University of Texas for faculty, and then was recruited to the University of Florida about 11 years ago to head up basically being the department chair of biomedical engineering, as well as continuing my research in biomedical nerve grafts.
Yeah, so I just want to ask a quick question. So I have a friend that is in Illinois or Urbana-Champaign, the same school, and he's telling me that it's extremely freezing there. So I mean, for you that came from Texas to Illinois and then to Massachusetts, like regarding the weather, like was it kind of hard for you to like change or adapt to it?
Yeah, it was. So I actually went from Texas as an undergrad. I went actually originally to the University of Pennsylvania in
Oh, that's
Philadelphia. That was a total shock. And then my advisor moved from UPenn to Illinois. And so that's why I finished my PhD at Illinois. So UPenn was a total shock to my system because it was cold, not as cold as Urbana-Champaign, but it was Philadelphia is a huge city, so that was a really big shock and hard to sort of come to grips with. But yes, the cold was definitely something that encouraged me to come back to Texas and then to stay in Florida and then come to Florida, so stay in the South. So was not a big fan of all of these ice and snow and the blizzards. So there was a big blizzard in MIT the year that I was actually getting ready to leave. And I said, oh, thank goodness I'm leaving this weather.
So I have a question. So I know you did your postdoc at Bob Langer's lab. So
Yep.
I've actually had a few of Bob Langer's students that came on, and so I asked them this question, each of them. So his lab is one of the largest BME labs, I think, in the world. So
Yep.
what do you learn from him?
So what I learned there is that it was a great lab for doing a postdoc. I think I would have been really intimidated, to be honest, doing my PhD there. So I did my PhD at Illinois with Doug Laufenberger. And so, I mean, at Illinois, yes, I can't think, Illinois with Doug Laufenberger. And so Bob Langer was great for doing a postdoc. I personally would have been intimidated as a PhD student, as I said, because it's a huge lab. And they almost have like little mini labs within this major lab. And you kind of have a cohort of a mini lab with some more senior, like research scientists, as well as postdocs and grad students. And so I had a little cohort where there were others who were there that were more senior than I was, and then those that were more junior. And so you kind of operate in this small cohort. And those are the people that you brainstorm with. And those are the ones that you talk about things with. And then every once in a while, you get to talk to Bob Langer. But not, I mean, I got to talk to him quite a bit, but it wasn't as frequent as that cohort. So you kind of have a different, almost like a smaller system within a bigger system. And that's the group that you brainstorm with. But his lab was amazing. Oh my gosh, the number of seminars just in the Boston area. I mean, you could go to, Children's Hospital, you could go to Harvard, you could go and take advantage of all these resources. So it's an amazing place to do science. And Bob Langer's lab is like awesome. I mean, he had every piece of equipment you can think of. When I was like trying to look for a piece of equipment, I said, oh, well, I can go talk to this faculty member over here to see if we can borrow theirs. And Bob's like, what? It's 300,000. We'll just buy it. So yeah, I mean, he has that kind of capital and that kind of money. So it was good in the sense that you could just do science and you had so many potential collaborators and people you could talk to. the downside is that you get used to the money, so that when you go to start your own lab as a
Oh, yes.
faculty member, you're not used to sort of, having to sort of, penny pinch in a sense. Whereas in his lab, he had so many resources, but it was phenomenal. I would recommend anybody who has an opportunity to visit his lab or to work in his lab. It's fantastic.
And also another question is, I know in this lab, like I think starting like a business with your patents like important in this lab. So my question is, did you ever like start like a business or something in this lab? Because I know some of his lab members like spun out startups and stuff.
Not, yes, no. His anybody who comes from his group is very entrepreneurial and very
Mhm.
entrepreneurial spirited, and I love that. So I did not start anything while I was in his lab, but since leaving his lab when I went to UT Austin, and then now here at Florida, when I was at UT Austin, we had technology that spun out of our lab and is part of a company called Axogen, which is actually here in Florida. And so they licensed our technologies. And then we have a startup company that I helped to found that is now in Austin. So I didn't do anything
Mhm.
while I was in Bob's lab, but after I got out of Bob's lab, I did. And I think a lot of people who work with Bob Langer have that entrepreneurial mindset. They're like, okay, these are some really cool technologies, but how can we make them useful for people? How
Mhm.
can we, have a real impact on people? And so I appreciate that.
Yeah. So let's talk about what you did at Texas. So while at Texas, you developed the Versa wrap tendon protector. So can you explain more about this and talk about it
Yes.
its development? Yeah.
Yeah, so this actually started. I had a fantastic graduate student named Scott Zauko who was in my lab, and he was
Mhm.
very creative spirit. And he came up with these really cool technologies of introducing crystallization inside of hydrogels, and that this crystallization, when they go inside the hydrogels, create unique properties in the hydrogels. The hydrogels now have elasticity and are stronger because
Mhm.
he was creating these interconnected porous networks by using this crystallization technique. So we'd crystallize things create a crystalline network and then wash out the crystalline network and leave behind interconnected pores. And what that did is it made these materials, again, more elastic and more robust than normal. And yeah, from there, we basically shopped this technology around. We went talking to people and said, hey, this is really cool that we have, but we don't know where it's going to be useful. And, Scott since graduated, and then I had another student, Sarah Mays, who's fantastic and very entrepreneurial spirited as well, joined the lab. And she was with me on this process of shopping this technology, like, hey, we've got these cool materials that, are non-adhesive, but they can stretch and you can do all these cool things with them. And, it was when we talked to this surgeon at a local hospital. We didn't have a med school at UT Austin at the time. And we went and literally just spoke with a surgeon and said, what do you think of this? And he said, well, this could be useful. He says, I do back surgeries and brain surgeries. And the problem is after these surgeries, these scar tissue forms everywhere and actually makes it very painful for the patient. And I have to go in and sometimes remove the scar tissue. And it's a real pain real pain. And he said, if you could come up with something, this material, since it's non-adhesive, it was a non-adhesive hydrogel film, this material could possibly prevent these scar tissue from forming. So we entered in a collaboration with him where he came into the lab side by side with my student, and they iterated. She would make the materials. He said, oh no, that's nothing, that doesn't have the properties I'd use in the hospital. Or, oh, this is getting closer to what I might actually be able to use in a hospital OR setting room. And so it was this interactive process with the clinician. And then we brought in other clinicians to help in the process for evaluating some of these materials. And it was this collaborative process between the clinicians and what they needed and what we could make that we were able to create this. And then this was at the time, very close to the time we were finishing and started this company. We were doing all sorts of preclinical trials in rats and trying to move this into the market. And it was at this time that I moved to Florida. So what I did is I left basically Sarah Mays. She graduated soon thereafter. And she basically became, one of the lead scientists at this company called Alifair that we had started. And then she literally took this from the bench to the bedside and made sure it got into human patients. And it's helping patients who have, tendon, injuries, who have tendon surgery in their hands, or it's now being used in back surgeries, can be used in nerve surgeries. So it's used in a lot of surgeries where you want to prevent scar tissue from forming and causing what's called these post-operative adhesions, which can be very painful and a huge medical burden and a huge cost. So it's a really cool story. And it was a lot of collaboration, a lot of student involvement. And my student, Sarah Mays, who's Dr. Mays, did a phenomenal job. When I left Austin, I needed somebody there to sort of spearhead this. And she spearheaded this. And she's still at Alifair now, 11 years later. And she sees all the success that she's been able to accomplish.
And I think recently now they have Dell, and then I think they're recently trying to build like a new hospital with MD Anderson, I think. And they're also building like a new facility for life science companies. So with all these like involvement, do you think Boston's going to be like the next biotech hub like Boston?
I think it definitely is going in that direction. And it definitely has a lot of, Austin in general has a very entrepreneurial spirit as well, because, Dell, of course, is there. And there's a lot of Dellionaires, as they call them, millionaires from Dell. And in general, there's a lot of businesses that sort of have emanated in Austin. So I would say that, yes, it is a growing thing. And I think it's I would highly recommend it. There's nothing that I wouldn't recommend at UT Austin. It was a fantastic place to, have at the beginning of my faculty career. Also, I went there as an undergrad. So I have a lot of experience with UT Austin, but, I think it's a good place, and it's got a really nice vibe to it, and live music scene and good food. So there's a lot of positives. So, and they have, like you said, they have the medical school now, which they didn't have when I was there. So that was something that I was really looking for in my career. And that's one of the reasons that I came to the University of Florida, was because it has this medical school, like literally right here. So I can just walk 5 minutes and I'm in the medical school. And we didn't have that at UT Austin at the time. They got it shortly thereafter. And keep in mind, the medical school is not as close as it is on UF's campus. You have to drive to it or take a bus. So it's not as close, but it's still a really nice resource there for them.
Yeah, and another question. So I think recently I interviewed someone and they told me that like supplements, there's like easier requirements to get it approved than drugs. So for medical devices, is there like easier requirements to pass
Yes.
them?
Oh my goodness. Yes. Getting a new drug approved is a lot of money and a lot of time. A medical device, depending on the medical device, it's easier to get through the market into clinical practice. So yes, a medical device has what we call lower barrier to entry in the market. And especially if you can claim equivalency. So if you can say that this device is similar to this other device that's already out there and operates very similarly, then you can get what's called a 510(k) approval. And that's a lot faster process. I mean, it still takes time. I mean, it was still, I think, 7 years from, 7 to 10 years that it took us to get from the initial part of the research to get into patients. But that's a lot shorter time frame than you would do for a drug. So medical devices are easier than drugs, and medical devices are easier if you can claim equivalency to something else that's already in the market. Because, it still takes time and a lot of money, but not as much.
Yeah, okay. So you also developed a new technique to redirect neurons along 3D paths in culture. So how could this technique like help scientists approach repairing damaged nerves?
Okay, so yeah, so you're talking about the advanced nerve graft now, right?
Yes.
So this is a different technology than what we use for VersaWrap. For VersaWrap, we used hyaluronic acid and alginate to create biomaterials that were films that were non-adhesive. With the advanced nerve graft, what we did there is we actually took intact nerve and stripped away the immunogenic components, the cells, and left behind the intricate microarchitecture. And then that was now a device, a biomedical device that's devoid of cells that we could use for implanting and guiding the regenerating axons along those pathways. So it's a little bit different than the Versarap, but it's still a biomaterial. It's just what we call a natural-based biomaterial. That's a derived from, it can be derived from tissues of animals, but the advanced nerve graft is not derived from animal tissues. It's derived from other human tissues that they're, tested for pathogen free, and then they're sterilized, and then they treat it to remove the cells and leave behind basically the structure of the nerve that can guide regenerated axons when somebody loses a piece of their nerve or has their nerve damaged.
I see. So, I have a question. So I know now you're in Florida, but when you first moved to Florida, like I know you said it's hotter and stuff, but I mean, there's always downside to stuff, and I think Florida is, there's a lot of storms in Florida. So
Yeah.
I mean, I asked you, how was your first experience? I forgot what name it was. The storm was like. So how was your first
This
experience?
was Irma, I think you're talking. The Irma was the first
Okay.
big one. Yes. Oh, that freaked us out considerably. So, because we hadn't been through this. So the first hurricane was scary, especially because it was scheduled to be like a Cat 5, 4, 5. It's supposed to be a big storm that went right over Gainesville. So it was really scary, and we didn't know really how to prepare. And by the time we thought about preparing, everybody else had wiped out all the water and all the stuff at the store. So it was kind of freaky going into the stores and seeing all the shelves empty. And so we got what nobody else wanted to get, and that was just, like Pop-Tarts. And and then we just filled up our own water bottles here. So there was no water anywhere. So instead of buying bottled water, we just filled up big jugs of water everywhere. And we lost power for 2 days, I think, at our house. So it was a little scary. I mean, we were all huddling in the in my closet, and then but it just ended up, I mean, it was a big storm, and it a lot of people were hurt, and there was a lot of downed trees and flooded roads, but for the most part it was a giant storm. And so since then we've been, there's been other storms that we've managed pretty well. And actually it's kind of exciting because you can go for the hurricane party. So I do know for Irma, we went to dinner at Bahama Breeze the night before the storm was supposed to hit. And that was kind of fun. We went with friends, and we just sort of had cocktails. We're like, okay, we're all ready. We're as ready as we're going to get. And then we went back. So it was scary, but it was kind of fun. It kind of was a bonding time with your neighbors, like and friends and stuff. It's kind of interesting. You sort of get to know your neighbors that way because you're all sort of preparing for the storm together.
So was it each year you guys do the same thing?
Yeah, so we've had a hurricane party since then.
Yeah, I'm just wondering. I just wonder how you guys get through that each year. This isn't because I'm
Yeah,
actually from
we know how to,
California.
now we know what to expect. I mean, it's basically like you'd prepare for any big storm, and every place has it. Some people are going to have, it's hard to, I prefer a hurricane because you can prepare for it than an earthquake, because an earthquake, you never know when that's going to come. And I prefer it over a tornado because we'd have tornado warnings in Texas sometimes. And that's scary because tornadoes are erratic and a lot less predictable than a hurricane. So in a sense, I prefer the hurricanes because they have a predictable path. And then you can make the decision if you want to leave, stay, and then you just prepare for it. So, and so I think it's been fine. Where are you located again?
So I'm actually from California now. I'm in Texas.
Okay. That's what I thought.
Yeah,
So,
exactly.
yeah. So hurricanes scare me less than earthquakes and tornadoes.
We haven't had one in a while for earthquakes, so that's why I was asking this, because I know some people from Florida, and they're like, "All right, so each year, like, we have to like just go to the grocery store and just buy all the water and stuff." I'm like for us, we never had that. It's like
Yeah.
it's really rare for us. Like there's probably some, but it's like it's not. It's the magnitude's like really low. So that's what.
But plus, you can't really prepare for an
Yeah,
earthquake too
exactly.
much. It's just going to happen or not happen. So whereas a
Yeah.
hurricane, we know what to do now, and yeah, so we can just fill up water bottles and then you just huddle down. It's actually fun family time. We play a lot of games, and it just, and you get a lot of fun snacks. It's kind of, it can be a fun time. I mean, it's a scary time, but it's a bonding time too. So
Hmm.
you just get used to it. There's
Yes.
going to be something wherever you go. So
I know you licensed the Avanca Nerve Graft to Astrogen in Florida.
mhm.
So this time, like, why? Like, I know you. Like, I know. I think Alifair, you were involved, like, in it, like the founding of the company. But
Mhm.
for the Avanca Nerve Graft, like, why weren't you like actively involved in after?
So, so Axogen was a company that already existed. And
Uh-huh.
so they were born out of Florida, so here in Gainesville or close to Gainesville in Alachua. So they were a company that already existed that was focused on peripheral nerve, and they already had technology that was licensed from somebody else here at UF. But the licensed technology was for removing a certain component from the nerve
Hmm.
tissue. They were very interested in our decellularization approach, which is how we get rid of all the immunogenic components. And so so when we were at Texas and developed this process, we published it. We first of all protected our IP by filing our invention disclosure. We published it, and then they read the paper and said, we need this in our company. So they contacted us and wanted to do a straight up license. Actually, first, before they licensed it, they wanted to show proof of concept that this would work
Hmm.
in human tissue because we had done everything in rat tissue as proof of concept. So they actually, what they did is they sent somebody from their company to basically work in our labs and live in Austin, which he loved living in Austin.
Okay.
So Austin's a fun place to be. So, but he came in and, basically worked in our laboratory side by side with the students to make our lab sort of like almost like GLP, like almost like that will get approval for like FDA, if it goes through FDA protocols and approval, that it will be approved for that. So they came in and worked side by side and did this with human tissue, and showed that we could do the
Mm-hmm.
decel with the human tissue and still get the same results. And then once they got to that point, they took the technology and basically ran with it in their own company. But we were involved in the sense they showed us, some of the graphics in terms of the logo design for the advanced graft. They brought in possible
Mm-hmm.
packaging and so they got our input on a lot of different
Okay.
steps, but we weren't part of the company. We were just a license to them, but they did involve us and, ask for input in different stages of it and have always kept us in the loop. So, but it was different. I didn't want to do a startup. I was a younger faculty then. So I was pre-tenure, so it didn't make sense at the time for me, at least for me, to do a startup company. So having them come and want a license, I'm like, yay, you go for it and you do it, because they already had the motivation and they had the money to do what they needed to do to get it through
Mm-hmm.
FDA approval. Because it takes a lot of money to
Yeah.
do this
Mm-hmm.
and a lot of time.
Mm-hmm. So I want to give you a scenario. So let's say there are two, three companies trying to use their IP, right? So how do you decide which company to grant like a IP to, and like what criteria or factors do you consider?
That's a good question. We have not had that problem. So, so
Yeah.
we haven't had the problem of multiple companies coming after our technology. So with the decell nerve, it was just Axogen coming forward and wanting to license the technology
Mm-hmm.
for this. I think it would involve, multiple things. One is they have to meet the criteria for the university, because the university is really the one negotiating. So, because it's a university, the the intellectual property is owned by the university, not the inventors. The inventors are part of it, but it's the university that makes the decisions, and they will involve the um, um, the inventors and some of the, they will certainly involve the inventors in the decision. They don't want to tick off the inventors, but it's really the university at the end of the day that says yay or nay. And so they're certainly going to look at what's going to provide them, the most royalty income, because that's how the Office of Technology Commercializations at universities operate. They are funded completely by these royalty returns on patents. So they need to make sure that that money's coming in. They're going to look at, the stability of the company. What is the probability of success? A larger company coming in wanting something is going to have probably a higher success opportunity than a brand new startup, if that makes sense, because they're going to have the capital, they're going to have the know-how. So they'll look at things like that. The university and the inventors would look at, okay, do they have, a good business plan? So you're going to look at their business plan. You're going to look at how are they going to market it? How are they going to produce it? And so you would make a decision based on what you think is going to have the most opportunities for success with those companies.
So I have another question personally. So what I've heard while I'm actually testing right now is that the splits for the IP is like, I think for UT is 55%, 45%. Do you think these splits are like bad split necessarily?
Yes. Okay. So there's different universities are going to have different royalty splits. The University of Texas, when I was there, it was 50-50. 50 goes to the universities, 50 goes to the inventors.
Oh, they made it worse now.
It's now 55-45. But I have to say that it's probably one of the best in the country. So most, UF, it's not that good. Most, the university gets a big chunk, departments get a chunk, and then the inventors maybe get 30%. So 30% is a little bit more typical. 35% is more typical nationally. So UT, don't tell them this, but UT is probably one of the more lucrative ones for the inventors. And then with the inventor distribution, you're going to have multiple inventors on a patent. And that just depends on, usually they look to the PI, the main person who runs the lab, for what the split is going to look like. And then if somebody is on that patent and disputes that, they can dispute that. So if they don't think that that's the good appropriate split, then they can dispute that. But most of the time, the commercialization office will side with what the PI says because it's their lab. So for me, my way of splitting it has always been equal split. So like if there's 3 of us, it's 33, 33, 33, right? If there's 2 of us, it's 50-50. And I've always split that with my students. And so my students, the student who was on the patent for the D-cell tissue for the advanced nerve graft, he got 50% of the royalty incomes that came to the inventors. So, but it depends. Some faculty will take a larger percentage than their trainees, but it depends.
Okay. Because I saw it and I thought it was a really bad split for the inventors, but I didn't know it was one of the best in the country.
Yes, no, it's actually, I mean, I haven't looked at all of them, but it's one of the better ones. So UT Austin's actually one of the better, and even now with 45, it's still one of the better ones.
How about compared to like your other colleges that you've been to, like at Bob Langer's lab? Like, is it worse than UT, or is it?
I don't see any royalty income from anything at MIT, so because I didn't have anything there. So I don't know what it's like at MIT, but the UT Austin is better than UF, for example. And then I have heard from other people who, when I tell them what UT's was, like if other colleagues at other universities are like, wow, that's really good.
I see.
But I don't know. I haven't looked at all of them, but I would have to say that UT Austin's is probably one of the more generous ones.
I see. Okay. So, you were awarded a UF Research Seed Fund for your project on engineering tissue to investigate heart disease. So, my question to you is like, is there any progress on that project going?
Not with congenital heart disease. We are doing engineering mimics we still work on that for nerve tissue, but for the congenital heart tissue, unfortunately, my amazing collaborator, who's the expert in the cardiovascular system, moved back to Japan to help her mother who was really sick. So I lost that collaborator. What you'll find is that research is so highly dependent on who your teammates are and who your collaborators are. So we're not working in the cardiovascular system anymore, but we do tissue mimics for nerve tissue. And we're doing a lot more work in the area right now of spinal cord injury, injectable biomaterials. So that's a bigger focus of where we are right now, is for spinal cord injury.
So I actually looked through your current research using naturally derived hyaluron. Can you correct my pronunciation? So it's
hyaluronic?
Yes.
Hyaluronic?
Okay.
Okay.
Yes. So why do you think this molecule can help promote the natural wound healing cascade?
So why are we using hyaluronic acid?
Yeah, and why do you think this molecule can help promote the natural wound healing cascade?
Yeah, so hyaluronic acid we work a lot with. So there's two main materials that we work with in our lab. One is the decellularized materials, and then the other is hyaluronic acid based materials. And the hyaluronic acid is also a component of the VersaWrap for Allofair. For those, it's a component of that. We like hyaluronic acid because it's a natural material already in the body. So your body has it. It's actually ubiquitous. It's in animals and chickens and pretty much everything. And it's a natural component in wound healing already. So it plays a major role in wound healing. It also plays a large role in embryogenesis. And during embryogenesis, there's a huge amount of not wound healing, but more like tissue development. So hyaluronic acid already plays a large role in wound healing, but also development of tissues. And so we use that there because it's a natural material that stimulates the wound healing cascades. And it's naturally non-adhesive, so that makes it nice because then we can program in and add in other components that that help with adhesion. So yeah, we use it because it's already a natural component in the wound healing in the body and part of the wound healing cascade. And it adds a lot. There's a lot of flexibility with hyaluronic acid too, because we can cross-link it so that we can make it basically link the chains together, so we can make it stiffer or make it weaker, or tune it for whatever applications we want. We can make it a hydrogel. We can make it a film. So it has a lot of flexibility in terms of how we can use it for a biomedical device or a biomedical tissue product.
So I know recently people have been talking about Californians going to Florida and stuff. So how do you envision, Gainesville, becoming like a biotech hub? Like, what key factors do you think should be used
for Gainesville to become a biotech hub? That's interesting. Well, we need a bigger airport.
Okay.
So, and that's a reality. So the company Axogen that has licensed our technology, their headquarters are in Alachua, which is right here by Gainesville, but they just moved part of their company to Tampa. And one of the main reasons they moved to Tampa was because of the airport, access to a bigger, more international airport. So I think for Gainesville and Alachua to really become a biotech hub and attract people, I think there's a lot of interest in the area because it's beautiful. It's absolutely beautiful, gorgeous trees. We have springs everywhere. It's not too far from the most amazing beaches in the country. So it has a lot of great, it has a lot of great attributes to it and very attractive. And with the University of Florida here, there's a lot of talent, engineering talent, but also sciences. And we have the med school and the health system. So there's a lot of perks, but it's going to be hard for people to move here if there's not a bigger airport, just because there's a lot of busy professionals. So, and we have an airport, it's just a smaller airport. So I think if we got a bigger airport, and that's one of the things you mentioned about Austin, right? So in Austin becoming a really big hub for industry and biotech. Well, I was born in Austin and grew up in Austin. Austin had a very small airport many years ago. And one of the things they did, 20 years ago, 25 years ago, was make the turn the airport into an international airport, right? And they moved the airport out there, made it an international airport. I mean, it still is not a hub in the sense that you still have to make connections, but it's still a bigger airport that has a lot more flight routes and a lot more options. And that, I think, was a huge part of Austin's success and growth. Without that, I think if they hadn't done that, I don't think you would have seen as much growth. Because I mean, people who are working at Dell need to get places, right? People who are working at Tesla need to get places. So people need a busy hub of like intellectual activity and needs to have, good flight options. So so that's one of the things I think was a good contributor to Austin's success. And I think if Gainesville were to do something similar, that could help build up their pipeline because they have all the essential elements for everything else for
I
success.
see. Okay. So I know you've had some experience serving in a journal papers. So I just want to ask, can you share like any experiences from your role in like just um assessing like the papers that are submitted through the journal? Like for example, have you seen like any big mistakes in some papers where you had to like, flag it and send it back?
Oh, in terms of reviewing papers,
Yeah,
there
reviewing paper.
actually was a paper that you have to be really careful because nowadays there's such pressure on publishing that there are people out there that don't necessarily are not as honest as they could be. And first of all, it's better to you always publish what you have. And, even if it's not the best results, never ever, try to put in. So from the standpoint of running the lab, what we try to do is we try to put in best practices so that we don't have bias. So wherever you can add in blinded studies, wherever we can blind our studies, meaning we, ahead of time we listed ABC, have it, can hide what the systems are. And that's why when you're analyzing the data, you don't know what it's coming from. Because if you know, you might say, oh, well, this is my test case. I want it to look better. So you may see something better. So wherever you can blind your studies so that you don't have bias is important as an investigator. And then as a reviewer, when you're looking at other people's papers, making sure you look for things and flag things that don't look right. If it looks like, ooh, this looks like it could have been artificially, like somebody may have manipulated this image, call it out. We actually had a paper once, and this was back when I was in Texas, where somebody sent us something to review, and a good chunk of the paper was plagiarized from our papers.
Really?
Wow. Yes.
Oh,
Like
okay.
where they just verbatim copied sections of our stuff and some of our data. And so we told the editor this, and they did an investigation, and and they withdrew the paper. So the key thing is to be on the lookout because these things can happen. Bring it to the attention of the editor. And then on the side of you producing good data, be conscious of the fact that sometimes you might have unbiased, your students could be biased without knowing they're biased. So putting in control systems where people don't know what they're looking at, putting in blinded systems, having people, different people analyze the same thing. So that's what we do a lot of is we'll have multiple people analyze the same thing to make sure, because it's harder for multiple people to be biased the same way or fabricate data the same way. So putting in controls so that you have the best possible data, because that's just not good. It's a science and it costs a lot of money.
Mm-hmm. So, so another question is, so I think BME in general is like a new field slash major.
Uh-huh.
Of let's say from now, like as you've done a lot in this field, like w- what do you see as like the biggest challenges in BME just trying to go forward and potentially become like more popular than like the other like like the computer science.
Oh, well, maybe we don't want to be as big as computer science. That's big.
Yeah.
So, yeah, you're asking me for a crystal ball. That's hard to say. I think, you know, the industry demand usually is what dictates
Mm-hmm.
the the student demand. They sort of kind of go back and forth. The more people that we have hiring, the more students we're going to have room for, and it's sort of those tend to go hand in hand. Biomedicine is going to be here, and it's going to grow. I think it's going to grow at a nice steady pace. I think it's going to be much more sort of like a consistent pace versus like where we've seen in AI and in computer sciences where you see these big peaks and valleys. I think, health and biomedicine are going to be they're always going to grow, but they're going to kind of grow at a more consistent pace. And the reason is healthcare is always going to be there, right? I mean, we have, everybody's health is really important, and we have, aging population, and we have new, issues that come up. I mean, the pandemic, gave us, a good example of some of the technologies that are now developing because of the pandemic. So there's always going to be a need for healthcare and biomedicine. So I think this is a strong area to be in. I think it's always going to be strong. And I think though versus what you see, the undulating sort of peaks and valleys you see with like computer sciences, I think it's going to be a more consistent, always upward growth. I don't see this dipping because health, medicine, and aging are always going to be there.
Uh-huh. So, is there any eh, so no, I just want to ask this question. Is there any like advice you would share to students, like you want to become scientists or potentially, you know, like biotech people?
So advice that I'd give to students. Yeah. So, um, you know, definitely just work hard.
Uh-huh.
So, work hard. I think getting a research experience is always very important. So, and
Mm.
the research experience could help you whether or not you go into a company or whether or not you decide to go to grad school. A lot of biotech and biomed does require more advanced degrees because it's a little bit
Mhm.
more challenging in some areas because it requires just almost like knowing two subjects, right? So most of our students will go on to advanced degrees. And so getting a research experience is going to help whether you go on to get a PhD or a master's, but it's also going to help if you decide just to go into industry. So I say getting a research experience is a great thing to do when you have a chance to take classes in biology. That's very helpful for sure for this field. And then if you're very interested in more of the biotech industry, trying to get an industry internship in the summer as well. So certainly research is helpful, but also an industry internship can be helpful.
Yeah, and I just want to ask. I think you mentioned how BME people they have to get like a PhD or something. So I think years ago there was a similar trend for I think CS students where they have to get like a more advanced route. Do you think like in 5 years like BME is going to go to a point where if you just get a bachelor's like you're you could go get a job or do research?
Um, there's certainly going to be a larger portion of
Hmm.
bachelors that are going to be that are hired, and we certainly have a number of our bachelors that go out and get jobs right away. In the medical tech arena, there's certainly a lot of room for them, but I would say, compared to mechanical engineering and electrical engineering, where 90% of the students are going into industry. What we're seeing is maybe 30-40% of our students are going into industry straight out, and the rest are going into law school for IP technology, or going into med school for being physicians, or going into grad school for PhD level industry or for academia positions. So I think there will probably be a shift to larger numbers, maybe, 50-60%, but I do think there's going to be still a large portion of our students that are, a decent portion that are going on for advanced degrees because there's still a lot of development that's requiring these advanced degrees.
So thank you, Dr. Smith, for being part of the show and the chance to talk about biomaterials.
No, thank you. This was a
Mm-hmm.
lot of
Mm-hmm.
fun.